We are going to discuss how we can make changes in the Plan, Do, Study, Act cycle webinar. We'll walk through how to design them, figuring out which change we should target, and then how to go out caring about a test of change and to learn from those, building a foundation of simple tasks and then scaling them up to spread more far and have a broader scope. We've identified our processes that we are currently doing and how we may embed at certain points or with particular people PMP evidence-based messages or best practices, and how that can help us get towards PMP's specific aims and global goal. With the cone of learning, we are hearing stuff from me speaking, you are seeing stuff on the screen, you may repeat some of this back in a conversation or a team meeting as you prepare, but until you get to that active phase of learning, which is our Plan, Do, Study, Act cycles, and doing what we've been talking about, that is when you're going to fully learn and remember what we are trying to do and form habits around these evidence-based best practices. So the PDSA cycle is very succinct and concise. It is 4 steps: Plan, Do, Study, Act. You may have heard it as the Schuhart cycle or the Deming cycle, or more aptly named the Learning and Improvement cycle. It was developed by Walter Schuhart in his Schuhart cycle that had 3 steps in a straight line. You're going to specify, produce, and inspect. And then it was edited by Deming, who modified this cycle when he was talking about statistical quality control and added that step of redesign. How can we learn from what we've taken into account? And then the Japanese executives that were working in Toyota took Deming's information and put it into the PDSA cycle and learned about how they can do things on a continuous improvement effort. Here, the PDSA comes into our model for improvement theoretical framework that Nolan and Provost have built, and it is that final way of adapting those 3 questions of what we're trying to accomplish, that aim, how we will know changes in improvement, those measures that we've outlined from the beginning, and identifying changes that will actually result in improvement. And that's how we use the PDSA cycle to test changes, measure them, and see what direction they're taking our improvement efforts. The PDSA cycle is how we test changes and how we can see if they are pertinent to the clinical setting that you're in. They give us a very simple framework to work in so that we can learn on a small scale regardless of the environment that you're in. They allow you to answer questions related to our aims as a project, a collaborative, a practice team, and to test them so we can see what works with particular people, the providers in your practice or patients, the clinical setting and unique barriers that you may face or strengths that you have, using the current knowledge about what works and how confident that you feel something may or may not work, and then working to adapt that test of change to fit perfectly within your environment. And then after you've done a series of tests, it allows you to implement and look at things on a broader scale to spread items if there are more people or places to spread this information that you've just learned to. So testing, which is what the PDSA cycle is for and what this part of the quality improvement project pertains to, is to learn what works on a small scale with your specific environment in mind and doing tests over a wide range of conditions. We don't want to invest a lot of time or staff, effort, money, data collection, planning, a lot of anything in this. It's very small scale. Get us just enough information to learn and inform our next steps and move forward either in the same direction but a broader scale, or change directions and retest. And then we can get to the implementation so that after we've done many tests, we've tried it in a variety of times with different people under different conditions, we can then integrate it into your day-to-day operations. Now we're going to talk about evaluation, and this is another one of those sustainability factors that will help you not only lay a good foundation during the quality improvement period, but as we wrap things up and move towards sustainability and have the work that you've done hold on for the long run. So we haven't had a sustainability factor in a couple webinars, and this one really looks at what methods and innovations we can do and utilize to improve the quality of your work. So as we're starting the improvement process, we have our background, our foundation, aims, measures, and starting to think about changes that may impact those two items. It's important to take a step back and lay out this plan. It could be very loose and address these elements, or you could sit and take some time at a team meeting and really think concretely about each of these steps and what outcomes you'd like to achieve now, shortly after the collaborative, and several months after the quality improvement collaborative project has ended, so that you can not only be successful now, but once we wrap, and make sure that we're laying a good foundation for embedding this for the long term. The plan should help you monitor if particular objectives were met, how you were able to do so, figure out why certain innovations and tests of change may have been more successful than others, and if you could only do a few items that would result in your level of improvement, what would these key factors and conditions of factors need to be to help you be most successful? So we're going to start by having this evaluation plan and trying to kind of use it as your roadmap, just like the key driver diagram, throughout this project. And this plan can provide evidence so you monitor your objectives, know why innovations were successful, and then help you identify those critical factors so that you can apply them to other scenarios. When you're thinking of a short-term outcome, what would you like to achieve with those initial PDSA cycles and test of change? And how can those lessons from those PDSA cycles impact those intermediate or medium-term outcomes? So you can build upon lessons learned, short, medium, and towards the long term. And this really mirrors the work and the scope of PDSA cycle lessons and learning through the improvement effort. So why do we have to test? We have a gap in mind. You have gone through and collected your baseline data and have an idea of where you currently are with respect to PMP's measures and aims and where we would like to be. And with that gap in mind, we can think about several changes that will have the desired impact or may have the desired impact and see how they can lend towards getting towards closing that gap. We want to close the gap incrementally so that we can see if something works and then scale it up and have a larger impact. And by doing it in that fashion, we're not only not investing a lot of time or people to a task that may not work best for your environment. It allows us to understand what works best so that we can believe more in this specific change and what its impact is to go in the direction that we would like to go. And that's why it's an opportunity to learn without really impacting your performance. And you can catch and redirect in a very quickly manner because you've gathered just enough information, you haven't been doing the test for very long, and you can go in another direction if that is the appropriate way to go. And then it allows you to adapt good ideas to the specific situation. So you may be scaling things up and figuring out what works best, or you may be using some of the evidence-based best practices, and you need to figure out how you can fine-tune and mold those to meet how your provider's clinical flow looks like, what the patient population's needs are, or you have an ever-changing practice front staff. So any of those features could be why you would need to adapt what we think is a best practice to a best practice for your clinical setting. When you make a prediction about a change, you have some degree of belief that this prediction is correct. That degree of belief may be low, medium, or high, and that's okay. Your degree of belief is really dependent on a couple of things. First, the extent of which your prediction is supported by evidence, And that evidence might be research, best practice, your experience, any knowledge you may have gained from other testing of changes. Second, how similar are the conditions that you're going to be testing similar to the evidence and how it was collected, and how much does that apply to your clinical setting? And then when we develop a change, our degree of belief starts off slow because we really may not have full knowledge to support this test and any predictions that we have made. And as we do more testing and discover what works and what doesn't work, as well as get a better understanding of how this process fits within our workflow that we're trying to improve, our degree of belief increases. And when our change results in improvement, it continues to move from that low to medium to high level of confidence that this is appropriate for our providers, different clinical settings, different units, and then we know what works in improving our degree of belief and moving the change that results in improvement. So when you look at this diagram, this really kind of demonstrates it as we're trying things with different people and different conditions at different times and scaling up the scope of the change towards implementation, our degree of belief is also scaled up at a similar time frame. So here is the PDSA cycle, and the first step is to plan. Have an objective in mind, a series of questions that you would like to answer, and a prediction or hypothesis about why this test of change will lead to a particular impact. And then we look to plan and having a concise outline, just a few steps noting what will occur during this test of change, who may be responsible in each of those steps, where this may happen, and when. One thing to highlight here, the planning section really ties back strongly to the key driver diagram. And here with the key driver diagram, I want to call out the SMART aim for tying it to what we're trying to accomplish. So hopefully what your test of change does is impacting one of those specific aims. Your work should always be tied to a key driver, which are those three elements in the middle, that you are providing age and developmentally appropriate preventative care and anticipatory guidance, you are assessing for risk for excess weight gain, or you're intervening at an early age for obesity. If you're ever having an issue of thinking about what test of change you should work on, that's where that final column of interventions comes into play, and you can choose one of those. I'm going to figure out how, within the second box, I'm going to provide age or topic specific P&P handouts to families. How does that fit within my workflow? How am I going to do this? Who is going to help with this? Where should I have the handouts? And those are the different things that you can test because they impact a key driver that will help you impact one of the specific aims. So that's a nice place to start too if you don't have a change in mind. And then you know that it's tied to a key driver. It's one of the messages or topics that we know will impact a key driver and we've seen in past initiatives and will move you towards making improvements in our specific aims. And another point to iterate here as you're in this planning phase is to do cycles on the smallest scale as possible and within the shortest time frame as possible, thinking cycles of one. I know it's hard sometimes to think that a short time frame or doing something with just one provider or one patient is really going to give you a lot of information or to learn from. But this is a way to help put down a good foundation, figure out what works for you, and then start moving the needle in larger chunks and working towards those specific aims on a larger scale. But you also want to test things out and see what works best. So in that planning phase, just keep thinking one clinic afternoon with one provider with a handful of patients, and let's see how this works, and then we can always scale it up. So once you've put down and had some time to figure out what you're going to do in your planning phase and how this ties back to your evaluation plan, you can move to the next step, do. You're going to carry out the plan, run through the test of change, see how everything goes, and document any problems or unexpected observations, and collect any data that you may have outlined in your plan that can help inform and measure whether or not this moved you in the right direction. Then the study phase lets you analyze the data you may have collected, be it quantitative or qualitative. That certainly informs next steps just as well as having concrete numerical targeted data. But then comparing the data to your prediction or hypothesis that you've made or questions that you wanted to answer, and see if you address those items. If not, why didn't that happen? If you did, what are some of those takeaway lessons that you've learned? And let's summarize that information so that because this was a small test of change that you started with, you can share that information with the rest of your core quality improvement team or other providers or people within the clinic so that you can then expand this based on what you do with the final step of the cycle. And that's the act step. What changes are going to be made? Is this something that you need to test again before you actually bring it to other providers or other times of day during the clinic or other days? Is it something that works perfectly and you can scale this up and you can suggest that this is how people go about with the change that you've tested towards reaching your specific aim? Or is it something that just didn't work and you need to abandon it and try something different? And you can use the information from the lessons that you've summarized in the study phase and the decision you've made in the act phase to figure out what route you're going to take with your next test of change. So that brings us back to that office flow map. You had outlined the map in a deployment swim lane about what your current process for birth through 5-year-old well child visits looks like. And hopefully you've had some time to consider what are key things that we think we can incorporate into our office flow, but we're not exactly sure on how to go about doing those. And you've identified a change and potential measures that you could use to evaluate if this change is having the desired impact. This is the content that you can take and put in that planning section of your PDSA worksheet. And that's what I have displayed here on the screen, the worksheet that you'll use to document your test of change journey. The top section, that first box of information, is really just to highlight who's on this team and the leader, and what your long-term goal is. So thinking back to that evaluation plan, you wanted all birth through 5-year-old well child visits to receive a PMP parent habit question. And this impacts your system, the patients that are attending these well child visits, and the providers that are working with patients. But for this specific cycle, this PDSA cycle, you're testing a change. You're not exactly sure how you're going to get these questions out to families. So the aim of this cycle is for one clinic afternoon, again, we're thinking small, at least 75% of those birth through 24-month-old patients of Dr. Smith will receive the PMP questions while you're rooming the patient. And then we can move into the plan that helps us know what key driver we're impacting from that key driver diagram, outlining what will happen here and what we think will happen. So the key driver from the key driver diagram that we'll be working towards impacting is providing age and developmentally appropriate preventative care and anticipatory guidance. And we're also working on that second key driver of assessing risk for excess weight gain. We have some questions that we're trying to address here, again, because we're learning. How will the front desk remember to give out these questions to the family? Who will give this form to the provider so that he can review the responses and he or she can prepare for the next patient? And how will we ensure that the questions that we're asking of families are recorded in that SMART or DOT phrase that you've set up? The plan for right now, just what we're testing, is to have the front desk provide the parent questionnaire for birth through 24 months, and then we will calculate what % of that population received the form and had it completed. We're going to do this just during Monday's afternoon clinic, and we'll check in and see if it's completed in the waiting room. And our method of evaluating this will be the number of those families that completed the 3 questions out of all those families that attended a well child visit during that time. Our process and our kind of outline and plan is to huddle to determine when these visits happen. We're going to discuss how we're going to remember to give these handouts at the front desk. The front desk will provide the 3 questions to our families and take tally that they've given one, as well as well child visits that were attended. So we have that numerator and denominator for our method. And then we'll come back at the end of the afternoon and review the data as a team. What will we predict will happen when this PDSA cycle is completed? We think that the front desk will be very good about providing this question set to the family at check-in. However, we're not sure how all the forms will get back to the provider so that they can review the responses and put them in the chart. We'll start this December 1st and we will finish it that same day. As you can see, the PDSA worksheet that we've developed fits in nicely with the flow of the PDSA cycle visual. So we've identified our goal of getting the tool questions out to our birth through 24-month-old patients, and we're looking at the question of what changes do we need to make or reach to get to this goal. And we're at the planning phase and we're moving on to the do. And it's really helpful to think of this as a mini science experiment back from grade school. We have our purpose, we've done some research, and we've made a hypothesis in the plan phase. We're going to carry out the experiment now, and then we'll come back and analyze our results in the study phase and make some conclusions in the act phase. So then we can move on to the second half of the PDSA worksheet. You've predicted what you thought was going to happen, you've outlined a plan, you have some data collection process in place, and have moved on to see how this works within the practice. The do phase, first, did it happen as planned? Yes or no? And then what happened? What did you observe? Were there any special circumstances, things that weren't part of the plan? The huddle worked nicely. You thought that it helped you flag those individual families that would be getting these questions. It was really easy to give families just 3 questions. And most of the time you found that the nurse was just asking the questions of the family and checking it off on the sheet, which they then gave to the provider as they walked in. Your results, for the most part, matched your predictions because you thought this was going to happen. But we learned that about 75%, so we hit that goal right on the head, of our birth through 24-month-olds had to complete the form prior to seeing the doctor due to the assistance of the nurse answering the questions with them. So our next step is to decide, what are we going to do with this information? We met our goals and aims. We answered the questions we wanted to address, and we're going to adapt this a bit. We're going to now try it with the older population of 24-month to 5-year-old indicator questions and do them at the same time. We found out that it may be helpful to make copies to keep these in all the rooms, or to look at it as we are asking the questions and just directly entering it into the EMR in that smarter dot phrase. As we get better at this, we thought we could do that direct entry, but we're going to just try and see how it goes first by having multiple handouts with the questions in every room. So key points. Your PDSA cycles can never be too small. Cycles of 1 help you learn best, and then you can always scale up. Failures are sometimes really good learning opportunities, and they can be better than the successes. You've learned that something doesn't work, you know why it doesn't work, and you can put in a fail-safe to prevent that from happening in the future. And that fail-safe may also apply to other situations as well, not just PMP and not just a specific test of change. And then as you move towards implementation, test these under a variety of conditions. Different people, different clinic settings, different well child visit ages, a whole variety of things. Any different condition that you can think of, try it out so that you feel as confident as you can be in this test of change before bringing on all the providers in your practice, spreading this to different clinical settings. And as you're doing that and thinking about how you're going to spread this, think about what people are going to say, like, no, this isn't going to work. I don't have time for this. I can't do this. And as you think about those factors that naysayers may be bringing to your attention, put those fail-safes into place to prevent that and have some information and lessons learned to give back to those naysayers and said, I considered this and these are the lessons that I've learned. And that helps you work to ensure that there's little chance for failure as you move this towards full-scale implementation. Common PDSA pitfalls, and I've tried to address each of these as we move through the webinar, is to make sure that we pay attention to that key driver diagram so that what we're working on impacts a key driver. It may be pulled directly from the intervention column. It may be something that's associated to one of those interventions or best practices. But what you're doing is impacting a key driver that will directly impact a specific aim so that you can move towards the goals that we've all set. Make sure that you have some idea about why you're doing a test so you can come back and reflect on if something worked or not. If you don't know what you were working towards, then it's really hard to know if something was successful or a failure. Try to do the whole PDSA cycle. In fact, you need to do the whole PDSA cycle and not just plan and never get it up off the ground and have enough time to devote to trying this out and studying and learning, or learning too much. Doing this test of change for too long of a period of time. You keep doing it, and you never have time to learn from what you've done. Try to learn from those failures too. Put those fail-safes in place. Back up the evidence that you may provide to naysayers that I've done this, I saw what didn't work, and we've learned from it, and we've bolstered the system to prevent that from happening. Have enough information to form everybody of their roles and responsibilities, and that's where the office flow comes in nicely, especially with the deployment swim lane outline. So you have what people are already doing in layering in that PDSA cycle and tying those two elements together. And then this comes back to your evaluation plan. Failure to think ahead a few cycles. If you've gone through and devoted time to that evaluation plan, you know what direction you're going to take. And if a cycle is successful, how that's going to tie into your short, medium, and long-term outcomes. So your action items for your team meeting is to plan a test of change. You're going to be doing this twice. This is the first time. So take the stuff that I've shown in this webinar, the office flow diagram, your key driver diagram that has our project aims, but any individual aims that you may have, and think about ideas for that test of change. Use your evaluation plan to identify a game plan for you're going to do X, Y, and Z throughout the course of this improvement project, and this is what you plan to do with each of those tests of change. Some common places to start from, especially since we've put together that SMART or DOT phrase with you, is to figure out how you're going to use and document information around those parent indicator questions, those birth through 24-month and 25-month through 5-year well-child visit questions. Your use and documentation of providing well-child visit PMP handouts. And then thinking too, as you look more process-oriented, instead of just using a tool or documenting something, to look back at prior well-child visit charts to see if any goals had been set so that when you get a little further into this initiative, you are able to identify a goal that had been set previously, use your motivational interviewing skills again, follow up with that family on their progress, and help coach them for the next steps. And think about this sequentially. Again, that evaluation plan. Think about your short-term goal and how that helps you reach these project aims. What resources, people, activities do you have at your fingertips that can help you with this first PDSA cycle? Once you've done those items and you've done your first PDSA, you can submit that back to the PMP team and then work on scaling this up to align with your evaluation plan and subsequent PDSA cycles. If at any point you have any questions about how to do a PDSA, how to fill out the PDSA worksheet, don't hesitate to reach out to myself or a project manager, and we'll be able to walk through this with you and go through it in a manner that we did in the webinar and really help facilitate that process for you.